Institute of Medicine's vision about what public health should be doing. I happen to have had the great pleasure of being inducted into the Institute of Medicine and realizing that it's partly honorific for work that you've done about bringing a diverse group of individuals together to tackle some of the tough challenges that no one discipline, no one entity can solve. And so, interestingly, this policy perspective that was drawn from the Institute of Medicine, and let me just kind of get the rest of the stuff on the slide. I didn't realize this was going to work a little slow here. Anyway, it came from the Future of Public Health report that was in 1988, but I think it's still relevant today. And this report actually influenced a lot of the projects that the Institute of Medicine has since done, because the Institute of Medicine takes a very systems approach, it takes a very population-based approach. It's really developed from the concepts that form a fundamental basis for public health. And there's some basic premises, of course, in that public health is really to fulfill society's interest in assuring conditions in which people can be happy. And that word assuring is really a key point that's emphasized in your literature in public health, and it also kind of permeates the Institute of Medicine's belief. And it's really, if we are helping the individual and the community at large to have a better health status, then we are accomplishing something that's good for society, it's good for all individuals. And that's really the premise that we're trying to achieve. Now, in medical school, there's a lot of focus traditionally on just one-on-one. The physician works with one patient, and of course they obviously have many patients they see over the day. Just like in nursing, you're working with many patients, but you're obviously at any one time generally working with one patient. It's the same way in medicine. So you have to take that and extrapolate, and that's really what public health does. It really gives us the opportunity to look at the big picture and how these pieces, how the multiple community needs fit together. So this is kind of like preaching to the choir, but I thought it'd be worthwhile just reviewing some perspectives that I have that hopefully you share that provide some common ground with us. Some of the areas in terms of what public health is doing is community focused, monitoring the health care that's there, and looking at ways it can be enhanced. Part of that's through policy, part of that's through regulatory effort, part of that's through preventive health measures that can be introduced, including immunizations, which really kind of turned around some of our understandings of public health by giving us some true interventions that had immediate impact. But to make that work, we have to begin at the policy level thinking about, well, what makes sense economically? Where do we get benefit? And public health, when you look at it, has the most positive impact in terms of what can be done in terms of injury prevention, illness prevention. And this is something that all health professionals have to be involved in. And so it's a big emphasis in our medical school. Medical school, for the medical students in particular, has a community-based focus, and it's a part of our curriculum. And we get them to look beyond the individual patient. We get the students to look at the breadth of care that needs to be delivered and these interlocking aspects. A big area of interest for our students is global health. And I've been educated a lot by Satoru Ozutsu and Walter Patrick on that. And I realized that it's not how do you deliver health care in another part of the world. I've been to Europe and seen how things were done in the UK. I've been to Australia. I've been to Tehran, Iran, and seen how health care is delivered there. But that isn't really global health. Global health is really understanding how health care issues in one part of the world influence healthcare elsewhere. We know we're in a global economy and we're in a global health situation. So illnesses, diseases can be transmitted between regions. Economic conditions in one part of the world can influence health and economy elsewhere. And so we have to understand these interfaces. One of the interests that has developed that's a good interplay between public health and the medical school's efforts is the issue of ecology of healthcare and diseases. That is, there are certain illnesses that we may be able to, with massive efforts, eradicate, but in many cases it's not really eradication, it's control, and how do we get the best effect. And so putting our efforts into understanding how nature, how the economy, how population movement is important to understanding health and how we can optimize it. So that's a part of global health as well. Tremendous issue on the interest on the part of our medical students and those entering public health. I think we have to recognize that our future trainees are going to want more and more from the standpoint of how these pieces fit together on the macro scale and not just in their local community. So the community as defined in global health is much larger. I think this is an important area that's going to impact our educational efforts, and we have to collectively do this. Another area where I have had some personal interest from my background in emergency medicine is in terms of the whole issue of emergency response and preparedness for emergencies, whether man-made or whether natural disasters. And there are systems of healthcare that we have to think about, and we have to conceive of how we move some traditional healthcare delivery services into areas that have been affected by such disasters, and also how we ameliorate and reduce the risk of illness and further injury by some actions that don't require health professionals perhaps to do, but they need health professionals to help guide. And it's interesting, some of the work I've been doing most recently have been with individuals who've been looking at working with leaders in communities who have to make decisions on operations of schools, operations of businesses, in terms of traffic flow in the settings of natural and man-made disasters. And if those are done poorly, if our leaders in the public sector and in the private sector are making poor decisions that don't have an understanding of the forces that are out there and how they interplay and how they affect health, they may very well compound the situation. For example, if there is a major epidemic that's developing, do you decide that you immediately close all the schools because you're afraid that the children will transmit the illness and then bring it home? Well, as soon as you do that, you shut down a large part of your economy, because now the children come home, their parents have to be at home.